So the initial radiological literature really focused on CT chest in terms of chest imaging. And that was partly because there was a limited availability of the PCR kits in China. And the role of the imaging in your department will depend on a couple of things. It will depend on whether you're a hospital or a community-based clinic, and it will really depend on the local rate of infection. So if you're in a pandemic epicenter, then your imaging pathways will be very different to an area where there has been very limited community infection. It will also depend on how the patient is presenting as well. So whether they are presenting with very mild symptoms, they're asymptomatic, or whether they have quite a moderate to severe clinical course. You do need to be very careful about the risk of infection being transmitted to the staff and to other patients, and also depends on what your own resources are for imaging in your department.